Good morning, everyone. Today's my topic for seminar presentation is Mayer's functionally generated path. Now, topic can be this topic will be covered under the following heading. So, functionally generated path. According to the 9th edition of Glossary of Prosthodontic, it is defined as a registration of the path of movement of the occlusal surface of teeth or occlusal rim of one dental arch in the plastic, wax, or other medium attached to the teeth or occlusal rim of the opposing arch. So, a functionally generated pathway in simple terms is a static representation of the opposing cusp dynamic movement from a centric position to the eccentric position to achieve an optimal articulation and occlusal harmony. So these are the uses and the prerequisites for the functionally generated path. Now it can be used for a single crown, for complex full mouth reconstruction, for removable or fixed dental prosthesis, and for the implant prosthesis. A prerequisite being presence of an optimum occlusion, elimination of the interferences prior to making an impression or making a registration. Appropriate anterior guidance should be present and opposing teeth should be present. This functionally generated pathway technique is normally used in the fabrication of the maxillary posterior restoration with bilateral balance function occlusion while eliminating the non-working side and the protrusive interferences. In a natural dentition, there are two types of occlusion, that is the mutually protected or the canine-guided occlusion given by D'Amico, and the second one is the group function occlusion, which is given by Schuler. So this Mayer's technique for this location to determine the location of the upper posterior teeth are different from the concept of occlusion. Now, many theories and many concepts were given how to determine the plane of occlusion. Now, Mayer has given theory based upon the location of the opposing arch, the opposing teeth, which does not have any interferences, which can help us in deciding the plane of occlusion, the cusp tip, and the cusp incline of the occlusal tooth. So the method of representing the centric and the eccentric relation between the maxilla and the mandible for the fixed or removable reconstruction can be divided into two groups. That is the method using articulator and the method by using a functionally generated part technique. So Mayer was the first to describe this technique in 1993 for fabrication of the dental bridges. So these are the armamentarium which is required for the fabric for going for the fixed functionally generated path. So it requires petroleum jelly, cotton tape applicator, cavity varnish, tacky wax, piquet instrument, Bunsen burner, fabricant, mounting stone, spatula, plaster bowl, sable brush, functional index tray, or we can say tooth blade, laboratory knife, blade, custom impression tray, impression material, mixing pad, syringe, bite registration frame, bite registration paste, die stone, dialog tray, and the twin stage occluder. So the procedure for the fabrication of this functional core for fixed prosthodontic is now, before starting with the proximal reduction, only the occlusal reduction was carried out for the opposing teeth, and a square or a tacky wax is positioned over the teeth being prepared. Now, once it is being attached on the occlusal surface, the patient is asked to bite in the centric position first. Now, once the patient is bitten on the centric position, the patient is asked to move the mandible to the working side. Once the working side patient has moved the mandible, patient is asked again to slowly close in the centric relation position. Now, once he returned to the centric relation position, then patient is asked to move the mandible to the non-working side. Once the non-working side registration is recorded, patient is again asked to move his mandible or her mandible in the centric relation position. And after that, from the centric relation position, the patient is guided to in the protrusive motion. The patient is asked to move the mandible in the protrusive motion and again in the centric position. So all this registration of this particular movement is recorded on the tachyvax, which is applied on the tooth, and the registration can be made with the help of the functional core can be obtained with the help of the impression of this tachyvax. To obtain the functional core, an unneeded portion of the functional tray is required. A functional tray is required. That this tachyvax is coated with the plaster first, and the tooth blade is used to record the indentation on the tachyvax. Now, with the help of stone or plaster, we can make a functional core of the registration. Now, once the functional core is obtained, the stone is poured in the functional core, and the byte registration frame is held with the byte registration set. Now, with the help of twin stage occluder, on the one side of the twin stage occluder, the opposing teeth is attached. On the one side, the functional core is attached, and the base member and the base, the upper teeth, the occluding teeth is attached on the twin stage occluder. Now, for this, on the functional core, after the tooth preparation is done, the proper wax pattern is prepared, and the wax pattern is, after preparation of the wax pattern, this is occluded on the twin stage occluder, and the proper anatomy is checked. To check the high point, a shoe polisher liquid can be used. It is applied on the wax pattern, and high point is checked. High point is removed, and the tooth anatomy is maintained with tooth anatomy can be shaped with the help of functional core. Now, if the restoration should be mutually protected, there should be no contact on the lingual incline of the buccal cusp other than the centric contact. And if, on the other hand, the restoration to be fabricated in the groove function occlusion, the lingual incline of the buccal cusp should be maintained continuous contact with the functional core. So, coming for the functionally generated part for the single crown. Now, suppose if you want to make a maxillary first molar, after the occlusal reduction, the tachyvax is attached. The patient is asked to do a functionally generated path in the working side, non-working side, and the protrusive. Once the registration is, once the bite registration is done, functional core is obtained with the help of impression, functional core impression, and this is mounted on the verticulator. Now, verticulator is a separate, verticulator is an articulator which will open in only vertical direction. The vertical height can be set in this articulator, but this articulator doesn't perform any lateral extrusive movement, protrusive movement. Only the vertical opening can be possible with the verticulator. Now, this in the same fashion, wax can be prepared, a tooth can be prepared, and the wax pattern can be prepared. Now, is it required for a single crown, the functionally generated path is required or not? Now, helpful teaching exercise, it is helpful in teaching exercise because it is easy for student to relate the bottom movement recorded in the wax. As a practical approach, this technique for single tooth replacement has minimal value, involves unnecessary extra procedure, long chaser time, and many instances proved unwanted results. So the occlusal pattern can be determined by rubbing the model together. Sometimes in the adjacent teeth there are mobile path which will fatten the wax pattern, so sometimes it can be excluded. So coming to the functionally generated path for mandibular teeth, is it required? Not generally used. Now, if the working or the balancing contact of maxillary teeth is too steep, the important mandibular curves will be wiped away. So this cannot be done for the mandibular teeth. So before fabricating the mandibular teeth, the incline of the maxillary tooth should be perfected first. So again, the added problem being stabilizing the base against the tongue and the cheek is a difficult task. In case want to use this technique, uh, cast base should be fabricated first. Over that, the indentation can be made. Now coming to the use of the functional core in FPD. Now preparing the wax pattern directly against the functional model. Also, after making the wax pattern against the anatomic model, refinement can be done using functional core, and also can be used to adjust the metal ceramic surface against the functional model. Coming to the case report, double casting method. Now here, what they have done is after the tooth preparation, the basic coping is prepared with a small uh, round wax inlays present on the primary coping. Now these will help it to retain the pattern resin, which will once the casting is done, this is tied in the patient's mouth. Now over this primary coping, a pattern resin is added, and it is placed in the patient's mouth, and the patient is asked to perform the uh, functionally generated path. Now, after moving the mandible in the working, non-working side, a specific indentation will come on the pattern resin, and it can be casted. This can help in the proper recording of the proper recording of the opposing tooth and help in the building the functional cusp. So coming to the functionally generated path in removable prosthodontic. Now in removable prosthodontic, it can be done in the complete denture removal, partial denture, a carborundum disc, or a trough can be prepared in the a trough can be prepared in the wax rim of the complete denture, and the patient is asked to move a functional movement. The patient is asked to move the mandible in the red working side, non-working side. As in the trough, there is a carborundum paste. This will set while the patient is moving his or her mandible in the functional pathway. So once it is set, this can be used as an occlusal plane for arrangement of the teeth. So coming to the advantages, functionally generated technique eliminate the need for adjusting articulator with intraocclusal records or tracing device. The exclusive movement produced in the mouth are more accurate, which when compared to the articulator, it eliminates the need of phasebow transfer. Also, it is simple and can be produced excellent results. So the disadvantage being the occlusion is in one of the hatches must be complete before functional generated path can be developed. The movement of the distal extension base carrying hard inlay wax occlusal rim is usual, and verification of record is most difficult. So coming to the conclusion, the method of intraocclusal registration using an articulator is time-consuming, expensive, and technique sensitive. Whereas in the functionally generated part technique, dynamic and static relations are reproduced directly in the mouth to capture the pathway traveled by the opposing cusp and mandibular function. In this situation, the articulator is reduced to a role of a simple hinge. It is a relatively easy technique to learn. The technique does not have an advantage of omitting simple, inexpensive instrumentation for restoration of the teeth. It demands a minimum chairside time, especially during the drying and cementation phase. These are the references. Thank you.